Hello viewers, today we have with us Dr. Janani, who is a consulting psychiatrist with TTK Hospital, and I am Soumya, Chief Operating Officer of TTK Hospital. We are going to have an interesting dialogue on concepts of addiction, and I hope it will be useful to you and your families. Hi Janani, today we are going to have a dialogue on addiction. Also clarify a lot of myths surrounding addiction. The first thing that I'd like you to address is when we talk about addiction, the first thing that people actually, the way they look at it is a moral failure or a failure in character. Sometimes it's attributed to the family, to the spouse. So can you clarify what is addiction? How do we look at it?
Interesting question, mainly because addiction is a complex issue. It's a bio-behavioral disorder, right? So there are biological factors. So in a sense, what I'm trying to say is addiction is a disease. It's a disease of the brain. However, it's also compounded by a lot of psychosocial factors, the person's surroundings, the family dynamics, the person's personality, how a person gets into addiction in the first place, and how it gets prolonged, the peer pressure, so many things. But in a sense, what we have to understand is the minute the person gets into an addiction, it essentially means there is a change in the brain chemistry, there is a change in the way the brain functions, and there are so many different things that are happening in the brain that we can't reduce it to just the person, say, willpower or blaming it on the family or the spouse. So we have to look at this from a very biopsychosocial model. You look at the biological factors, you look at the psychosocial factors.
Is there a genetic predisposition in this?
Absolutely. I think genetics plays a very strong role. We've often seen families where, let's say the index person has a substance addiction. Invariably, somebody in the family, sometimes it's even in the extended family where there is history of psychiatric illness. So there is a strong genetic component when it comes to addiction. Sometimes it's other psychiatric illnesses, sometimes it's addiction itself that runs in the family, which also needs to be looked at. So Soumya, you see a lot of patients on a daily basis. According to you, when do you think, at what age do you think substance starts, and how do you think it starts?
Typically, the pattern is during adolescence, but what a disturbing trend that we are seeing now, it's coming down, The youngest client that we've seen is about 7 years old, right? So the age of initiation is coming down over a period. It's a very disturbing trend that we are seeing.
Right.
And predominantly it is because of peer influence. And when these youngsters come in, like the boy who came in who was about 7 years old, he had started it because of his elder brother and his friends. Right. So that is the circumstances. These are typical circumstances where it starts, where they unknowingly experiment. And then they get hooked onto a substance unknowingly. And of course, it's a progressive disease. And it progresses to other substances as well. So the gateway substances that we are seeing now is Cool-Lip, Hans sometimes, and with more affluent families, it is vape. So that's how it starts, very playfully, very unknowingly, very innocently, and it progresses to alcohol, to cannabis, unknowingly. And then, the impact is, very intense. And as a psychiatrist, we've seen the comorbid conditions, the psychiatric issues that are seeping in. So the sooner they come, the sooner there is awareness, amongst parents, teachers, it's easier for us to also kind of bring in an intervention faster. So that's what we are seeing now.
Absolutely. And when do you think, let's say, for example, drinking. So somebody starts out socially, right? They probably drink on a weekend or with friends at a party. When do you think that becomes an issue per se? Or when do we look at it as a dependence?
When a dysfunctionality sets in. Absolutely. When, typically Mondays, an employee takes off because over the weekend he's binged, and on Monday it's very difficult for him to gather himself and go to work. These are typical patterns, and there is a dependency that is setting in, and there is a dysfunctionality also. So the sooner the family is able to identify that and seek help, it is easier, both for the individual and the treating team to kind of work and turn it around.
Soumya, thank you for that. Do you see a pattern whereby a person progresses from, say, social use to a dependence or an addiction?
Yes, it is a progressive disease. So we have youngsters experimenting with substance or social drinking in parties. Typically, it starts off when they go into college. There are these house parties, and that's when it starts. They start experimenting with substance just to kind of fit into that group, and slowly it moves to a hazardous pattern, where it could also be a maladaptive coping mechanism when there is a breakup, when there is an exam failure, or when there is something that is disturbing them. They take on to substances to cope, and then it moves to addiction. Many times they are also very functional, so there is really no reason to think that there is a problem. We have functional alcoholics who are extremely good at what they're doing. They've been successful as working professionals. Not much of disturbance they are seeing according to them at home, and it's all kind of going on well, though there is a drinking or a substance in the background. And then it moves to an addiction where there is a dysfunctionality that sets in, and it takes a while for them to even identify it. So that this is a pattern. Sometimes we also cannot say that this pattern, the progression is the same for everyone. Sometimes it's very fast for some individuals. Some individuals progress at a very slow rate. So we really can't generalize saying that this is the rate of progression. So that is one thing. But I think with substances it's really high, and the damage is also higher, which I'm sure you will be able to tell us about the damages that youngsters, especially the brain damages. Sometimes it's irreversible also, isn't it? So yeah, this is the usual pattern from social to addiction, social and experimental use to addiction.
And some also skip, isn't it? So they would have started socially and suddenly
yes, that's what it gets very intense, and they move to addiction, and it suddenly there is a downhill, right, in their health and the symptoms, everything. There is a downhill in their overall health. Yeah, sometimes, and I know of patients who are also very, very insightful. They keep monitoring their liver functioning, their kidney functioning, and they're continuing to drink, and they think if they monitor and everything is normal, they have it in control. That is their way of assessing, right? But I've also come across a client who in January the blood reports are absolutely fine, but in March or April his liver, it was a cirrhotic liver. That was that's where it had progressed, and it was unbelievable. But I think the downhill is pretty fast. Suddenly it just kind of plummets. Yeah.
So just a couple of minutes ago, you were talking about how the age of initiation has really come down, and your youngest client was almost only 7. How do you work with these clients, in the sense that how do you make them accept that they're actually going into a dependence, or they're already dependent?
See, denial is very synonymous to somebody who's addicted, right? With addicts, they are high on denial. They always think that there is no problem, they are in control. It is only the family that has a problem. But due to some kind of coaxing, and somehow they come here for seeking help, right? And most often than not, they do not agree that there is a problem. They would say that they can handle it by themselves. Right. And in February, slowly our admissions start picking up, because they've come back, they have started drinking, and every time there is a break and they start, the intensity increases and the problem seeps in, health wise, family wise, work wise. So they come back. It is similar during Lent. So people think that people challenge themselves that I can be without drinking, I can stay, I can abstain, and I do not have a problem. The other comparison is when you see them is I not fallen on the road. So I'm not, so according to them, an addict is the guy are people who have these blackouts and they're lying on the road, unconscious without knowing. So they always, there is a comparison in their mind. So it is a challenge for us to motivate them, get them to gain an insight. Sometimes we let them go, and we're pretty sure that they come back because it progresses. And we have many of our clients would have come 6 months back, 7 months back, 1 year back, and at that time challenged us in a way, saying that they do not have a problem and they can manage by themselves and they're in control. And it would have only unfortunately progressed, and they would come back seeking help. So that is the trend that we always see.
So we roll with resistance.
Yeah, we roll with the resistance. That's the only thing, because there is no point in compelling anyone for treatment.
True.
We especially, our founder was very clear that we will not compel people for treatment.
Absolutely.
And because we need their cooperation, and they need to be motivated to recover. We cannot force anyone and shut them inside. In the end, they would only go back out and drink even more with a lot of, vengeance. So that is, their motivation and their cooperation is much needed for the treatment.
Especially when we are, working with them through therapy, I think it's
much needed, yes. Otherwise, he's just going to come and not cooperate and give you a hard time, give himself a hard time, try and do things that would hamper his recovery. So their cooperation and motivation is important. Yes, when somebody agrees for treatment, it's not that there is 100% cooperation or they're motivated. At least somewhere we see some scope for us to start working on, and when we see that, then we convert that to admission and we work with it.
And I think also one of the signs of improvement is when the resistance, the denial comes down.
Correct.
They're willing to work on
Correct.
themselves. They're
That's
willing
right.
to talk about their problems.
Absolutely. When there is awareness and they're able to talk about it, and they're willing to open up and seek help and come from a place of, yes, I need help.
So, see, I really believe that family plays a pivotal role in aiding the entire process, isn't it? Most of the times, like you were mentioning, it's the family who brings the client in, and then we sort of talk to the families as well, and they are in a lot more distress sometimes than the patient. But I feel they are really there to kind of support and help us. So what do you think? What is their role?
Addiction is a family disease. As much as it affects the individual, it affects the family, right? And they bear the brunt of it. And in most situations, the society is very quick to blame the family when there is addiction, and very common is to blame the wife, right? Saying why the wife did not take care properly. But the most interesting thing is, when a youngster has an addiction issue, we've seen the next solution is to get him married. The thing, it's very quick. People are quick to think that if you get that boy married, his addiction will be all right, and when he has a child, he will completely recover. It's really sad because the whole family suffers, isn't it? It is a family disease, and we work with families here. It's as crucial as working with the individual, because they all need to recover and heal together. Yeah. So we have a family therapy program that is running parallelly for 2 weeks as the client is going through a 3-week program, and the counselors also spend equal amount of time with the family member, because we also need to understand the dysfunctionalities with the family so that it doesn't hamper the recovery of the client. And many times, Janani, I see the counselors bring a family member, and you will have to actually there is an intervention happening there also. So can you also elaborate on what are those issues that you see among family that they need a psychiatrist help, and you also support them with certain medication, and how that helps?
So like you beautifully said, addiction is a family disease. It's not an individual problem alone, and especially I think in our society where family plays a very important role in recovery, sometimes unfortunately in the addiction process itself. Many times we find that there is psychopathology in the family members, be it the spouse, be it the parents, the siblings, sometimes even the extended family. In TTK, I've noticed that people who come to the aid of our patients sometimes are a distant uncle or an aunt, which is absolutely amazing. They'll pitch in financially, they'll pitch in physically, but many of the times these people themselves need help from us, both psychologically and sometimes even with medications, because either they're depressed or they themselves are facing an addiction issue which they're not willing to talk about. They have their own psychiatric issues. So just like you said, how you guys are family therapy and we work with families through therapy, I sometimes medicate family members because like you beautifully said, the whole family has to heal. It's not a single person who recovers and then if the rest of the family is not in sync, it actually pulls the patient down. So yeah, many of the times I've medicated family members and there's no shame in this.
Yes.
Unfortunately, mental health has a lot of stigma, and I know I've gotten a lot of family members unaware, but I think eventually when the family member also calms down, we see such a smooth recovery in the client.
We are seeing, Janani, most in the wives.
Absolutely.
There is depression and there is a lot of anxiety, sleep issues, and the women are also going through their own challenges. What are the common issues that you come across, especially amongst the wives? Sometimes as counselors, when they point out, first these, there is a lot of denial. Okay, viewers, I hope that was an interesting watch. Stay tuned for more.